The Utah Professionals Health Program, or UPHP, is a confidential health program provided by the Division of Professional Licensing. The program is designed to assist licensed healthcare professionals facing challenges related to substance use disorders or other health conditions that either impair their ability to practice with reasonable skill and safety or have the potential to cause impairment. In alignment with the mission of the Department of Commerce, which is to strengthen trust in Utah's professional workforce, UPHP's mission is to facilitate the health and wellness of healthcare professionals in order to enhance patient care and safety. Licensees participating in UPHP are required to have a Worksite practice liaison. The Worksite liaison serves as a valuable link between the licensee, UPHP, and the workplace. The purpose of this video is to help inform both Worksite liaisons and employers about the Utah Professionals Health Program and their critical role in supporting healthcare professionals and the safety of their patients. UPHP does not provide treatment. Rather, it serves to promote the health and well-being of licensed healthcare professionals through coordination of assessment, treatment placement, and long-term aftercare monitoring. Confidential monitoring is the cornerstone of the program. At UPHP, confidentiality means when a licensee seeks help and is getting the treatment they need or undergoing monitoring with UPHP, neither licensing boards nor the public will know about their monitoring, medical diagnosis, or treatment details. This information is kept confidential, and there is no disciplinary action on the licensee's record. Programs like UPHP encourage the licensee to seek help sooner because it decreases the fear related to losing their license and career for seeking help. Monitoring is usually a 5-year process. It is guided by an individualized monitoring agreement comprised of recommendations from the evaluation and from the treatment provider. Monitoring requirements may include commitment to total abstinence, attendance at recommended treatment, aftercare and therapy, random toxicology testing, daily check-ins on an app or computer which notifies participants when they are selected to complete toxicology testing, participation in recovery support groups, recurrent appointments with an assigned clinical coordinator, meetings with a board-certified addiction medicine physician, work hours restrictions and controlled substance access restrictions, and Worksite practice liaison.
A Worksite liaison is typically a direct supervisor that has regular contact with the participant in their work setting. They should understand the signs and symptoms of a substance use disorder and be able to make independent, objective judgments without undue influence by the participant. Worksite liaisons are asked to make reports to UPHP on a regular basis regarding the participant's behavior and performance at work. In order to be approved to be a Worksite liaison, an employer must have a professional license in good standing with DOPL, not report directly to the licensee or be the licensee's peer, not be participating in UPHP or public probation, and have regular contact with the participant in the work setting. There are 2 main roles that a Worksite liaison fulfills: supporting and reporting. The primary way to support a participant is to know and understand their monitoring requirements. All UPHP participants are required to provide to you a copy of their program contract. UPHP will request verification that this requirement has been met by asking you to sign an acknowledgement of participation document. This is a document that both you and the licensee will sign, indicating you have reviewed the program contract together. Other ways to support licensees participating in UPHP include understanding the role of toxicology testing in monitoring the disease of addiction. Just like someone with diabetes who may require breaks to check blood sugar or insulin levels, toxicology testing helps to measure and document progress in recovery. Our participants in rural areas may have limited access to collection sites, and those sites may have limited hours of operation. We encourage those participating in our program to discuss testing with you ahead of time so you can work together on how to arrange testing on workdays. Some participants will have controlled substance restrictions for the first year of participation with UPHP, depending on their compliance to their program contract. A controlled substance restriction means participants should not have access to or accountability for controlled medications. those with this restriction should not be given access until the restriction has been lifted by UPHP. This measure helps to support those early in recovery. Additionally, some participants may have work hours restrictions or may be asked to re-enter their profession part-time. Hours restrictions help to create work-life balance in the lives of UPHP participants, which is an important aspect of recovery. If an amendment is made to their contract that lifts either of these restrictions, they'll be provided with a signed document that states the terms of the adjustment, which they can then provide to you.
The second role of a Worksite liaison is to report to UPHP. Participants are required to have their Worksite liaison submit regular reports on behavior and performance in the workplace. Reports are completed once per month for the first 6 months of participation with UPHP, then are required quarterly if the participant is in compliance with the terms of their program contract. If a Worksite liaison has concerns that their employee has returned to substance use, even if they are not certain, they should report to UPHP immediately. While employers may be concerned to report this, it is important to know that reporting is supporting a licensee's health and patient safety. Worksite liaisons should be aware of the signs of potential return to substance use or diversion of controlled medications. It is important to be aware that no one sign is indicative of a return to substance use, and individual signs may be attributed to non-impairing or isolated issues. However, a constellation of signs should not be overlooked, and the liaison should report to UPHP. Evidence of diversion or obvious signs of impairment should be reported immediately. Obvious signs: odor of alcohol or marijuana, impaired coordination, out of character or unacceptable or unprofessional behavior, intoxicated at home when on call, or slurred speech. Subtle signs: absenteeism or tardiness, isolation from colleagues, decrease in performance, completing rounds late, unavailable when needed, frequent trips to the bathroom, appearing at work on days off, mood changes after a break, unprofessional behavior, unusual personal struggles, or not completing notes in a timely manner. Signs of diversion: missing syringes or vials of controlled substances, volunteering to administer controlled substances for colleagues, underdosing patients, replacing controlled substances with other products such as saline, taking syringes or vials, taking PRN medications from patients, or pulling duplicate orders, patients complaining of unrelieved pain, creating false verbal orders, failing to waste or documenting waste of controlled medications, or raiding Sharps containers, documentation of administration of a controlled medication that a patient refused, discrepancy in counts of controlled medications or controlled medications with broken or unsecured caps or found in cabinets out of exterior packaging.
UPHP responds to return to use by providing immediate intervention and support, which could include referral for reevaluation of their treatment plan, a request to refrain from practice, and increased monitoring, all with the goal of helping a healthcare professional achieve sustained recovery and safe return to practice. The best way Worksite liaisons and employers can support an employee who has returned to use is to recognize substance use disorders and mental health disorders are medical conditions. Laws such as the Americans with Disability Act, or ADA, and Family and Medical Leave Act, or FMLA, are in place to support employees with substance use disorders. The ADA prohibits discrimination against qualified individuals with disabilities, including those with substance use disorders, and requires employers to provide reasonable accommodations to enable those individuals to perform their job duties. Employers can support employees with substance use disorders by offering flexible work arrangements, providing access to counseling or treatment programs, and ensuring a supportive work environment that encourages recovery. The Family Medical Leave Act allows eligible employees to take up to 12 weeks of unpaid leave for medical reasons, including treatment for substance use disorders. We would encourage employers to support employees seeking FMLA by providing the necessary paperwork and ensuring their position is protected if they require treatment or are on leave.
In conclusion, the Utah Professionals Health Program offers support and guidance for healthcare professionals struggling with substance use disorders. By fostering a culture of understanding, confidentiality, and proactive intervention, UPHP not only aids in the recovery of participants, but also enhances patient care and public safety. Employers and worksite liaisons play pivotal roles in this process, supporting the participants' transition back into their professional roles. When you hire or retain someone participating in UPHP, you can feel confident that you have employed someone who is actively taking care of themselves, ultimately ensuring quality patient care. Together, we can break the barriers of stigma and fear, creating a community where seeking help is not only accepted, but encouraged. Thank you for your dedication to the well-being of healthcare professionals and the patients they serve.